phobia is the illogical, unreasonable fear of old people and of getting old. And we have an epidemic of it.
Maggie Kuhn, co-founder of the Grey Panthers and one of the great leaders and spokespersons of our time, is making a unique contribution to American society. She is challenging age-related prejudice and generating national support for the needs inherent in the aging process, from the United States Senate to the American Medical Association. With her extraordinary energy and insight, Maggie Kuhn portrays the admirable spirit, commitment, and new image of aging in America.
Our focus is not on old folks' issues. We're not a gray lobby. We're not working for the special interests of all people. We're working for the special interests of people, humanizing, hopefully, and healing our society of its divisions.
Okay, well, welcome everybody to another edition of our monthly Transformation Tuesday series. On behalf of the Grey Panthers, I'm a member of the board, along with Carrie, who's on screen now, and several others. As the introduction video said, we are committed to fighting ageism in all its manifestations. And particularly one of our issues that is related to this is long-term care and fighting for the rights of those who need long-term care and need solutions to it. And as Maggie mentioned, it's not just an issue for older people, it's for families of all generations. So thank you for attending. It's an issue that we're going to be discussing today is the Essential Caregivers Act. And this is an issue that currently has both currency and urgency. It's being introduced to Congress, reintroduced, and it is legislation that would ensure that residents of nursing homes and other long-term care facilities have the right to designate at least one essential caregiver who cannot be denied in-person access, even during public health emergencies. As many of you realize, many of this sort of came out of COVID, but it's certainly an issue that is important going forward for any kind of circumstance that we face. So I think we're going to have a good discussion. I think I'm going to turn it over briefly to Carrie, who's going to introduce our three guests. So Carrie, take it away.
Well, actually, it's two guests and me, and I think most of you know me.
Well,
it's okay.
All right, that's true.
I'm Carrie Laljanal. I am the Vice President of Grey Panthers NYC, and I am also the mom of a 38-year-old, that happened a few days ago, son who lives in a long-term care facility, and I didn't get to see him for about 128 days in the beginning of the pandemic. And then even once I did get to see him, it was jumping through hoops that nobody should jump through. And I'm lucky he lives in a really good home, but that didn't solve my problem or anybody else's. And somewhere in the midst of that, I met Mary Daniel, who started Caregiver for Compromise. And she made sure to start one in every state. And somehow I got in charge of Illinois. And together we have had our voices heard. We've gone about it a little, probably non-traditional, but I think it's helped. And we need your help now. And Mary's going to start, and then when we get ready, I'll introduce y'all to Lori. Go ahead, Mary.
Hi, everybody. I'm excited to be here to share a little bit about my story and how Caregivers for Compromise got started. I'll briefly tell you that now. My husband, Steve, was diagnosed at the age of 59 with Alzheimer's. Very unexpected, kind of obviously changed our lives in many ways. And after about 3 years, I made the hardest decision that I ever had to make, and I placed him in long-term care. This was in 2019. I thought caring for him at home was the best level of care that I could provide for him, but I was wrong. He needed socialization. He was a salesman by nature. Loved making relationships and having relationships with other people, which made him great at his job. And I placed him in a memory care center in Jacksonville. I went to see him every single day. I got him ready. We actually had dinner with each other every night. I got him ready for bed. We would lay and watch TV every night until he went to sleep, and I would go home. And I did that on March 11th, 2020. And on March 12th, they called me and they told me, you can't come back. I told them that wasn't going to work for me. I saw him every day. I had to be with him every single day. And they told me, 14 days to slow the curve or whatever it was at the time. But the days turned to weeks and the weeks turned to months. And I started getting very worried. He lost 10 pounds in the first month alone. We tried 2 window visits. He cried both times. He was not able to he was not able to speak. He talked, but I couldn't understand anything that he said. So there was no value in a phone call or the iPad or any of that. He kissed the iPad. He didn't know what to do with it. We were just lost and completely separated from each other. So I started reaching out to local media. I wanted to get to the governor. I felt like I needed to speak to the governor of Florida. And so I kept tagging him and calling people. And I mean, it was an ongoing everyday effort to first talk to people about the idea of isolation. Obviously, that was something that was brand new in this realm. And thankfully, I had 2 reporters in Jacksonville who picked up the story of isolation and started talking about it. And so we were doing fairly frequent interviews about that. And it got the attention of my husband's facility. Out of the blue in June, they called me and said, because I had asked previously, we understand that you want a job. And I said, yes, I would like to have a job. And they said, we have a part-time job available if you'll take it. And I said, I'll take it. And then I said, what is it? And they said, it's a dishwasher. So I said, dishwashing it is. So after 2 weeks of training, who knew there was so much training involved of getting all kinds of TB test and of course COVID test and fingerprints and all kinds of 20 hours worth of training on hazardous food disposal and all those kinds of things. I started my first shift. It was July the 3rd of 2020. And my biggest fear was that he was going to forget me. He was not going to recognize me. He had always known me. And I was afraid that during this period of time when I was separated from him was going to be the time that he needed me the most. On the day that he was diagnosed, I promised him that I would hold his hand every step of the way, that I would be with him every day. He never was going to be alone. I would be with him till the very end. And all of a sudden, I wasn't able to do that. And what I told everybody that would listen is, what exactly are we saving him for or saving him from? He's dying. I know he's dying. The time is precious and he knows me now. He needs me today. He doesn't need me a month from now. He doesn't need me 2 months from now. Today is the most important day for him. He will be worse tomorrow and worse the day after. So there's a huge urgency for me to get to him before he didn't recognize me. And so on that very first day, I did a 5-hour shift, lunch and dinner dishes that day. And when I went in to see him, his back was to me when I walked in the door. And when he turned around, the first thing that he said was Mary. So I got to him in time. He still recognized me. He still knew me. I cried. He cried. It was amazing. It had been 114 days since I had touched him. And that story went viral. The news in Jacksonville took off with that story and it made national news. It was quite the frenzy. Everybody was talking about this story. We were getting interview requests from every single network, from just news stations all over. My sister told me, I don't consider it to be viral until you get on Inside Edition. And we were on Inside Edition and we were on Extra. It was really a crazy time. But that crazy time showed me was that there are a lot of people just like me out there. I'm in, but how many people, tens of thousands, hundreds of thousands of people are not in? And I couldn't just walk away and be happy with me being in. So literally in the middle of the night, the idea of Caregivers for Compromise came to me. That name means simply, we will do anything. We will compromise in any way to get in. I will wear a hazmat suit. I came up with all these great ideas, a clean room. We could scrub it and disinfect it after every visitor, whatever we need to do. We did not want to go in there and blindly throw the doors open. That was not what we were asking for. We wanted to do this safely. We obviously have a vested interest in keeping our family members and the residents of the facility safe. So we wanted to be sure that we were doing it the right way. So Caregivers for Compromise, because isolation kills too, became the name of my group. I founded a national Facebook page that was just taking off. People were joining it like crazy. And then I realized, wait a minute, every state is different. So we literally made a group, a Facebook group for every single state. And the most amazing thing is people like Carrie rose to the top in those states. Carrie took over Illinois. Mary Nichols, one of our absolute wonderful best leaders in our group, took off in Texas. It was just absolutely amazing the number of people who rose to the occasion. As I told them all, I can't do it in every state, but we can all do this together. We can come up with the same tools that we need, and our mantra has always been educate them so that you can educate everybody. In other words, we needed to educate whoever that was, being the administrators first, educate them on what the rules are. So many people didn't know what was happening. It was just a mess. Everybody was doing, you had facilities across the street from each other doing completely different things. So we needed to educate them so that they knew what the rules were. And then that interestingly enough, that education has now shifted from the administration. We're now doing that with politicians, educating them on what this problem was and why this problem occurred and how we can stop it from ever happening again. I'm incredibly fortunate to live in the state of Florida. Governor DeSantis heard my pleas and came to Jacksonville and met with me on August the 1st of 2020. Sat down, and the first thing I said to him when we were face to face across the table was, why am I allowed to touch my husband as a dishwasher, but I'm not allowed to touch him as his wife? And he said, I don't know, but we're going to fix that. And he did. We walked out of that room. He had a press conference announcing that he was going to have a task force to reopen long-term care facilities. He gave me a seat at the table of that task force, the only layperson in that task force. And 1 month later, we agreed to terms of opening back up that allowed us to touch our loved ones again. The touch, that was a deal breaker for me. The Surgeon General of Florida said no touching. And I said, I mean, literally sitting at the desk I'm sitting at right now, slammed my fist on the table and said, we have to be able to touch them. I have to hold his hand. I have to rub his back. I have to give him a hug with whatever PPE you want me to wear, whatever you want me to do, I'll do, but I have to be able to touch him. And he agreed. He said, the Surgeon General said, I will agree, but if we see any uptick in cases, I will say we come back, we revisit, and we look at it then. And I'm happy to report to you in Florida, we had 0 uptick in cases. As I mentioned before, we had a vested interest of keeping each other and our family members safe. And I brought accountability to staff. I will tell you that we all do better when we have accountability. And they were not deliberately not wearing their mask when I saw them. They were fatigued. This was a group of people who had been underpaid, overworked. It was really, really difficult for them in that climate, in that environment, and we all knew that. But when they saw me, they would pull their mask up, and they would just be better. We were both better and more compliant when we had eyes watching us. That's why we need to be in there. That's why visitation is so important. Accountability to each other is extremely important, and I was there to help them. I was not there to hurt them. I wanted to be their partner in taking care of my husband. And so we were very fortunate again in the state of Florida. We not only got back in, but we now have in Florida the No Patient Left Alone bill, which allows not only this visitation of essential caregivers in long-term care, but also in hospitals. So that we know in the state of Florida that no one is going to be left alone, to die alone, to watch their family member die through a window. Now, the exception to that, of course, is federal facilities, and that's where this bill is so important. That's why this bill is so important. We had VA facilities that would not allow visitation, and because they're federally funded, so many Medicaid facilities, that sort of thing, they felt they had a loophole and could fall under that so that they did not have to let us back in. And so we fought and fought and fought. This bill will allow us not to have to do that fighting anymore. We believe that there will be other things that occur in Florida. I will tell you, a couple years ago, we had a facility in New Smyrna Beach that closed due to scabies and a scabies outbreak. There will be things that cause closures. The weather, the northeast weather, the ice storms that we've had this year, all of those kinds of things. What if there's a measles outbreak that's a bit in the news these days? All of those things can lead to facilities shutting down and keeping us from being in there with our loved ones. So our work is not finished. Carrie has legislation. As I mentioned, legislation in Texas. We have a number of leaders that have brought legislation to their states, but our work is not finished. I will tell you that my husband passed away in December of 22. 3 years. It's hard to believe that he has been gone, but I will continue to fight as many of us that are still in Caregivers for Compromise and are fighting for our loved ones who have already passed, we're fighting for everyone else now. It was awful. It was barbaric. We were helpless. We were hopeless. And we don't ever want anybody to ever have to experience that again. So this bill is extremely important to us, and we're going to continue to fight till we get it passed. Thanks, Carrie.
Thank you, Mary. So I've probably heard Mary speak more than anybody. I didn't think Mary could make me cry anymore, but apparently I'm wrong. This is heartbreaking for every one of us. That's where Lori comes in. So National Consumer Voice has stood behind us in every way, shape, or form, speaking up for the residents, speaking up for the families, working with, on Capitol Hill, working with anybody we needed. We would not be where we are today if it was not for National Consumer Voice. Lori has been our champion from day one. She has educated us. She's told us what we were doing was right. She's told us that we were doing it wrong. But as a family member, we needed that. And as a group of organizers that truly did not know what they were doing, we really needed that. So Lori is the executive director from National Consumer Voice. She, like I said, she is a friend to every one of us. And I'm going to let Lori go from there.
Great, thanks, Carrie. Nice to be with all of you today. It's really nice to see some familiar faces. And so shout out and hello to all of you. It's great to see you and be with you all. And, it's been certainly a real journey that we have been on to address this issue, which, as Mary and Carrie have said, was really probably the darkest time for all of us as we have advocated for people living in long-term care facilities and residents. And I know that you all know that. And so the whole point here is that we need solutions, right, to ensure that this never happens again. I think, we've known there's been long-standing research about the effects of isolation on people, and that period of time during COVID when facilities were locked down really showed us the worst of what could happen when people are not being cared for, when they are isolated from their loved ones and not getting the care and services, the emotional support, and the other supports that loved ones provide to them. So I'm going to go over for a few minutes the provisions of the bill that has been introduced at the federal level. Next slide, please, Emily. Before I do that, for those of you who aren't as familiar with the Consumer Voice, we're a national nonprofit advocacy organization. We've been in existence for 50 years. We actually have a long-standing history with the Gray Panthers. Our founder, Elma Holder, worked for Ralph Nader and the Gray Panthers at the very beginning of her career, and she was very close to Maggie Kuhn, lived with her at one point, and it was during her time with the Gray Panthers and with Maggie Kuhn that she actually started the National Consumer Voice for Quality Long-Term Care. But our work is national in scope. We spend a lot of our time advocating for public policies that are responsive to the needs of residents and family members. We work to empower and educate individuals about the information they need to know to self-advocate and have the information about the resources, about the issues that they're dealing with. We work very closely with advocates across the country, including long-term care ombudsmen, and we work to train them. We house the National Ombudsman Resource Center in our office. And a big focus of the work that we do is related to staffing in long-term care, because without adequate staff, and that's numbers, training, competencies, supervision, there's workforce supports, there's all kinds of things related to that, but without adequate staff, we don't get quality care. And so that's been a primary issue for us. So next slide, please, Emily. So as has been said, has been reintroduced legislation in Congress, the Essential Caregivers Act of 2025. It's been introduced in the House and the Senate right now, and so I mean, it's really a testament to the advocacy that's been done by the Caregivers for Compromise group, by the Essential Caregiver Coalition, by all of you who have been really advocating on behalf of this bill, that there is bipartisan support for this bill, that it has been introduced in both the House and Senate with identical language. I mean, it makes it a lot easier when that happens in terms of getting a bill passed. But what this bill does is it focuses on the essential caregivers and ensures that residents of long-term care facilities have access to at least one essential caregiver at all times, including during any emergency situation where regular visitation may be restricted. I mean, restrictions on visitation should be exceedingly rare. What happened during COVID should really not be a normal result, and we should not see that happening. And I'll talk about that a little bit more in a few minutes when we talk about what the current law says and why this is necessary despite that. But as Carrie said, or as Mary said, this applies to facilities that are certified for Medicare and Medicaid. So nursing homes, skilled nursing facilities, inpatient rehabilitation facilities. What it does not cover are like assisted living facilities or personal care homes. Those facilities are governed at the state level. And so you need state rules that cover those types of facilities in order to have similar essential caregiver provisions. But these cover the federally certified nursing homes, which is what the Centers for Medicare and Medicaid Services oversees. Next slide, please. So when we look at the language of the Essential Caregiver Bill, essentially it requires that I mean, the importance of an essential caregiver, I couldn't say it any better than, what Mary has already said in terms of the types of supports, that an essential caregiver provides. Not only are they there, and an essential caregiver can be an immediate family member. It could be a person who is closest to the resident and whoever they designate. And so, and most of the time, I think it will be, an immediate family member. But they are there to help ensure the residents' well-being and safety. And essential caregivers provide all kinds of services and supports, including companionship and assistance with daily tasks and communication. They, as Mary said, work with the staff as part of, the caregiving team to ensure that care and services are actually being provided. It's an extra set of eyes, on what's happening in a long-term care facility, but it's also advocacy on behalf of the individual to ensure that their needs are being met in a timely fashion. But it's also that emotional support. It's providing love and caring and caregiving and touch. So you can't replace, all of those things. We are, as human beings, we need that interaction. We need that touch. And what we found, during that period was not only were families kept out, but a lot of staff were not there. No other visitors were going in. Ombudsmen weren't going in. Surveyors, nobody else was going into those facilities. There were no outside eyes happening. And, while the staff in, so many cases were really doing the very, very best they could in really untenable situations, it was the people who were suffering, the caregivers, the residents who were suffering and who were not having their needs met. And I can't tell you how many times during that time period, we heard from residents directly. We heard from the family members who were talking about what the impact was on people living in long-term care facilities. And I know that, the Caregivers for Compromise group, in the advocacy that's been done, have pulled stories from across the country and developed resources that really highlighted what the impact was on residents. And we were doing similar things in terms of talking to residents about what their impact was and raising their voices and doing reports on what people were seeing and hearing during that time and relaying those stories to CMS, to the policymakers, so that they were also hearing about what was actually happening or not happening in long-term care facilities. So, it's really critical that we get provisions in federal law where we don't find ourselves in that situation anymore. Next slide, please. So, in terms of the provisions of the bill, it's pretty straightforward. Essentially, what the bill says is that residents have the right to designate at least one essential caregiver that they can have access to at all times. And what we have been pushing for, if you're able to move to the next slide, Emily, but certainly, we believe that residents should be able to designate as many caregivers as they want, essential caregivers as they want. Now, it may be that one can go in at a time, but the resident will designate, which people they want to designate in that role. But the goal is to ensure that any time that there's an emergency situation where regular visitation is restricted, that there is an opportunity for a resident to have someone come in and be that supportive person for them. And it should be that there are no visiting hours that are attached to that. It would be whenever the time is necessary for the resident, whatever works best for them, that the person should be able to go in and provide, that support. There is in the bill a provision that says that there's an initial 7-day period at the start of whatever the emergency is where an essential caregiver can be prevented from entering the facility. There are some exceptions to that, specifically around end of life or if there's significant decline or distress that's occurring for the resident. But generally speaking, it's a limited time period. It's not unusual to see something like that. In fact, we were talking a little bit earlier that, even at the beginning of COVID, when we didn't quite know what we were dealing with, it was not completely unreasonable to say, okay, let's assess and say, what is it that we're dealing with? What needs to be happening in order to best protect the residents, the staff? What gear do we need? What equipment do we need? What are we dealing with here? And then how do we address that? The problem with what happened, in the COVID situation is that went on and on and on and on and on. But it's not unusual or unreasonable to say that there might be a couple days, in the beginning to assess what's happening. There is a provision that in some situations that there can be an extension of 7 days for a total of 14 days. But there can't be more than 14 days that are approved for any time for people to be restricted from going into the long-term care facility, the essential caregivers anyway. And that additional 7-day period has to be approved by the state health department. But we're talking about just an initial 7-day period. Essential caregivers will have to agree to comply with safety protocols that are set by the facility, but importantly, they cannot make those protocols any more stringent than what's required for the staff. And that goes back to what Mary was saying. You were willing to do anything to get into the facilities, and why would it be necessary to hold the family members to a higher standard than the staff that were going in and out on a daily basis? It wasn't the families that we were seeing, bringing COVID into facilities during that time period. And so ensuring that the safety protocols that are put into place for staff are also being followed by the essential caregivers is a really critical provision. There is language in the bill that if an essential caregiver fails to follow those protocols, that may result in denial of access to the resident. They have to be given a warning. If they still don't comply with the safety protocols, they can be denied access. There is an appeals process that's in place, and that would have to be followed in order to get the person back into the facility. But I think that it's pretty fair to say that almost all essential caregivers are going to be following the safety protocols that are necessary in order to go in and address that. It doesn't say what they have to be. I mean, that would probably depend on what the emergency is. And I'm sure that once this bill passes, that CMS will be instructed to develop guidance that will need to be developed, and we'll all hopefully have a hand in developing that. And then the last piece that I want to mention is that there is a provision in the bill for reasonable accommodations to be made in the event that a resident where an essential caregiver is coming in to provide supports or services to them, if they have a roommate, that reasonable accommodations need to be made to protect the rights of that roommate. So as you know, many residents are living in double rooms. Not all roommates are welcoming of having other people in the rooms. We actually had heard from residents, during COVID, that they were very fearful for themselves of people coming and going, from their rooms. And their rights also need to be protected. So those provisions need to be put into place so that roommates are protected as well, and their rights are protected. Move on to the next slide, please, Emily. So one of the questions that has come up with respect is, why do we need this bill, right? Because we already have the Nursing Home Reform Act, which has very broad standards related to visitation. In fact, the Nursing Home Reform Act and the corresponding regulations that go with it say residents have the right to immediate access to their immediate family members and other relatives, period. Hard stop. There are no provisions in the law or regulations that allow for restrictions on a resident's right to access to their immediate family members. And yet still we found ourselves in a situation where this had occurred. The other bullets there, I just listed them for your information. I mean, generally speaking, residents do have the right to immediate access to other visitors of their choosing, subject to reasonable restrictions that are based on clinical or safety factors, but those don't apply to immediate family members and other relatives. So, technically speaking, and we made these arguments with CMS, people should not have been kept out of the facilities, even if there were some restrictions, because any restrictions based on clinical or safety factors or any other reason is very limited in terms of who they apply to. Yet, as I said, CMS did find a way. They used their guidance to put the restrictions in place where they were instructing the facilities to not allow visitors in there. And as you have heard, and as I know many of you have experienced, that resulting isolation and lack of support and care was just devastating. We don't have good data on how many residents were lost as a result of the isolation and the failure to thrive and the loss of the will to live, but we all have just more stories than any of us should ever have related to how much of that occurred. And very early on during the pandemic, there was some quantification of that in terms of like 40,000 people had been lost, but that was very early on, and we've not seen other data. So despite the fact that we do have strong language in federal law, we need this bill to really be complementary and to supplement the rights of the residents to ensure that they do have access, even in emergency situations, that CMS and the government cannot go around them, and that we are ensuring that there are people there to provide those essential services. So next slide, please, Emily. Let's talk about where we go next with the bill. So as mentioned earlier, it's already been introduced in the House and the Senate. The primary team that has been advocating with Congress has been doing really an extraordinary job of educating members on the Hill about the need for this bill, bringing constituents from all over the country to share their stories. And there are a good number of co-sponsors that have been signing up, but clearly we need more, and we need to keep the pressure on them in order to get them to actually move this bill. It's not enough that it's been introduced. We need it to move and get passed. So the bills are being referred to the relevant committees that have jurisdiction and need to do their first review. So in the Senate, that's the Senate Finance Committee. And I've put the links in the slides, which I know the Gray Panthers team will share with all of you, that you'll know who the primary targets need to be. I mean, certainly you should be reaching out to all of your members of Congress, but at this stage in the game, you definitely want to be targeting the people on the relevant committees because they're the ones who are going to be taking the first look at these bills and the ones passing them out of committees and making recommendations to the full House and Senate related to passing them. In the House, there are two committees that have jurisdiction, the Energy and Commerce Committee and the Ways and Means Committee. And that's because both of them have some jurisdiction over either just Medicare, Ways and Means, and Medicare and Medicaid on energy and commerce. And so both of them will be looking at this bill. So we really want to target your attention in terms of calling the members of those committees to really say to them, we want you to support this bill. We want you to take it up in committee and pass it out. We need to get this bill passed. And you need to just be very clear on your messaging. If you don't know who your member of Congress is or how to reach them, you can go to the link on congress.gov or you can call the Capitol switchboard and they will connect you to your members' offices. So I'm going to stop there. On the next page is just some information about how to connect with us at the Consumer Voice. And I'm sure there are a lot of questions that folks have, and we can go to that.
Kara, did you want to chime
Yep,
in
there we go.
before we go to questions? Yeah,
Yes.
great. Thank you.
So thanks, Lori. That was a great understanding for everybody. So when I tell you that we would do anything during the pandemic to get our voices heard, we did everything, not just anything. So the yellow letter campaign that I'm going to explain to people in a few minutes, we did this during the pandemic and we bombarded CMS's office with yellow envelopes. We knew they would never open much past the first couple, but it was going to be very hard to ignore hundreds of yellow envelopes showing up at CMS, at congressional offices. They were showing up everywhere. After that, and when the bill was introduced, we made a book. So this has stories from every state in the United States. It has information actually about the first bill that was our attempt at a bill that unfortunately didn't go anywhere, but we still, we still made sure. And the book can still be ordered. I will actually in a minute put the link in the chat. On Caregivers for Compromise website, there is stories from 50 states that were done on video last year. So when Lori said, we really worked hard to get our voices out, we did. Was it always worked? We don't know. But what we know is there were people who knew who we were, and some who didn't like who we were, and that was okay. I have some slides showing, Emily, we pull my slides up, what this yellow letter campaign is. I built a toolbox to make this as simple as possible for people because the easier it is, the more likely it is that it's not showing, Emily. There we go.
There it is.
And we could just go right to the next slide. The easier it is, the more likely it is people will do this. I have set up a Google Drive that will have everything in it. Like I said, this here explains the yellow letter campaign is just a grassroots effort. We need people to buy yellow envelopes and to send them where we're asking them to be sent, demanding that Congress and the Senate act. They need to hear that this bill needs to go to markup. Right now, it is almost March. We have till the end of this year to get this bill passed, or we have to start over. And that's the hard part. Next slide, please. In total, we're asking you right now to send 16 letters if you can. 8 to Congress, 7 to the Senate, and 1 to your state representative. We have earmarked who these letters need to go to, and it's very clear in the Google Drive. So the 8 in Congress are the 4 people that are the highest ranking members in Ways and Means, the highest ranking members in Energy and Commerce. In the Senate, there are 3 that way, and then 4 others that were suggested to me of people we should target. Your state representative is important because you want them to hear your voice. Please feel free to send more letters, to call more people, to share this. Next slide, please. When you get into the Google Drive, you will see there's 3 different folders. One of them says instructions start here. You will find this inside of that Google Drive. It gives you the link to the drive so you can share it to other people. It also gives you the link to the bill. In multiple places through the drive, you will see these yellow envelopes and you will see how they are addressed. It is really important that we follow this format. One of the things we learned with the book is if you don't earmark who it needs to go to, it winds up in the office and nobody knows where it went. And that was a very expensive mistake for us to learn. Next slide, please. So, like I said, there's what the Google Drive looks like. It has a social media folder that has 4 or 5 graphics in it that people can use and share. We will work on putting more in there. There is sample letters, so you don't have to create your own. You please feel free to create your own or add to them. There is also clear instructions on the envelope for doing the envelopes, and there is a folder of instructions of how to get you through and what you're looking for. And next slide, Emily. So when you get to whether the House or the Senate, this one is for the House here, they will look, there is this piece of paper telling you who to send these 8 letters to. They have their name, the legislator's name, the state they're from, their mailing address in DC. And then you'll either see that they're from the representative of the Ways and Means or Energy and Commerce, because it's going to be really important, next slide, that we write on there, attention Ways and Means, health staffer. Here is a condensed version of the letter that you can use if you do not want to write your own. The letter itself does not necessarily have to be on yellow paper. It's the envelope that really makes the difference. And like I said, down below, I'm just giving you a few little things of, if you write your own letter, these 2 paragraphs are very important to be in there, please. Next slide. And here's my envelope that I will talk everyone's ear off about. It's just really important that on the front, on the bottom left, at least once, if not twice, on the back, that we clearly put who we want this letter to wind up in their hands, so it doesn't wind up in the wrong person's hands and goes nowhere. Next slide, please. So like I said, there is multiple graphics here, some explaining what the Yellow Letter campaign is. That one we would love if you would share on your social media, share it on Facebook, share it on Instagram, anywhere you can. Any of this, the more we all share it, the more people will help us. You know, wouldn't it be nice to know that 3 weeks from now is an anniversary that none of us ever want to relive? That by that point, that maybe our, Energy and Commerce people and Ways and Means people have maybe all seen a couple hundred, if not a couple thousand envelopes showing up. Next slide, please. And like I said, these are all just, and I added some hashtags. If you're going to post anything on social media, it really will help if we start using hashtags, because then it will make it so people can find the others. That's all I understand about what hashtags do. I'm not going to lie to anybody. Next slide, please. And these 2 are just, I mean, I went to the so trying to make sure we have one for the Senate, one for the House, and the one for the House clearly marks both. But again, the more we get it out there, the better chance we have of getting this bill passed. The one thing I would really suggest that maybe, I don't know that we've touched on, is this is not about COVID. This bill is not about COVID. This bill's about isolation and what could happen. And we need to focus on that way more than we ever need to focus on what did happen. We need to focus on what could happen and what we're trying to prevent. Um, if you've ever heard me speak before, you've heard me say, my son can live where he is for another 50 years. He's 38. He's healthier today than he's ever been. Taking that into consideration, I'm doing this to protect my son for when I'm not here to fight for him. Next slide, please. And then here's just some elements of things that are in the bill. Um, Down on the bottom left, when you get to number 4, one of the reasons that things like alien invasion and zombies were put in there is to really do just what I said. Get away from the pandemic, get away from COVID, and make people understand we're doing this for safety. And it's really, really important. Okay, and I think there's one more left. Next slide, Emily. And we could not do this without everybody's help. And we appreciate anything anybody's going to do to help. You can reach out to Lori, you can reach out to Mary, myself. We're all very accessible. And we are more than willing to answer questions or help and or any of the above. That again is that QR code will take you to directly to the Google Drive. If you have an idea of something that I should put in the Google Drive, please send it to me, let me know, and we will work on adding more things as we go. The 15 targeted letters right now are where we felt it was the most important place to start. We will be expanding that and targeting other members and ways and means and energy, but right now we're just trying to get the people that can get it to be heard that they know we need this. And Emily, I'll let you take questions from there.
But before we take questions, I just wanted to thank all the panelists, Carrie, Mary, and Lori, for a robust explanation of the issue. I just want to say how impressed I am with not only with your passion and your commitment, but the practicality and your willingness for compromise and accountability. It's a rare combination these days when people really are reasonable but passionate about their commitments. I don't know if you have you want to answer any particular questions, Emily. I did notice in the chat there were some comments about, and perhaps we could just clarify about why this is so critical. Some people were asking whether, how do we differentiate this from amending the current law, and why this is particularly important to have new legislation. I wonder if
This,
anyone.
Go ahead,
I'll
Lori.
take that. This does amend the current law.
Okay.
That's essentially what it does. But the way you amend the current law is to put forward the new language, and this is a bill that includes some additional sections that will be added. But essentially, it does amend the current law. And it's necessary because they found a loophole the last time. And this provides stronger language and more clarity as to what needs to happen in the future. And that's where we need to, be pushing so that we can hold them accountable.
Paula, are you asking, are you, just because I want to try to help here, are you saying that by adding the law, we're confusing things? Because I want to make sure we're not confusing people.
Paula, you want to speak up, or you're not on?
So, in terms of some of the questions that Paula had put in, maybe it gets to something that she had asked earlier, which is how is an essential caregiver different than the resident representative, for example, or a person who's an agent under power of attorney, or something like that. It might be the same person. It might not be. And one of the examples, that that I think about is, I mean, if a person may designate, let's say a resident has two children, and they've designated one as their primary contact when they've gone into the long-term care facility, to, be the one that is on the books for the facility to call if, they need something, or to keep them updated on the situation that's happening in terms of the condition for that resident. The resident may also designate that child number one, daughter number one, as the essential caregiver who, in the
Did we
event of
just
an
lose you,
emergency,
Lori?
can go in. Um, can you still, am I
Now
there?
I can.
Okay. Um, but it that it might be also that they want the second person to be the essential caregiver, the second child to be the essential caregiver, or their spouse or their sister or whomever to be the essential caregiver to go in the event of an emergency situation like this. So they may choose somebody else. And it's up to the resident to determine who it is that they decide. I mean, we think that the resident should be able to name multiple people to go to be an essential caregiver. So if you have two children or three children, or a spouse and two children, you should be able to name all three of them as your essential caregiver. Does that mean all three are going to be able to go in anytime, all at the same time? Probably not. You may be limited to one at a time that goes in the effort to control, you know, egress and access to the facility. But that gives all three of those people the ability to go and provide those supports, to provide that comfort care, to provide that companionship to the resident that's in that facility. And so that's why there's a difference in term, because there might be multiple people that we want to be designating to have access to that individual.
And somebody just put in the chat, I lost it as quick as I saw it. The representative might live 200 miles away, you know, especially buildings that have regular volunteers, and you have a resident who does not have family, or their family is far away. That volunteer might be their essential care person, because that is who comes and sees them 3 times a week. This gives the resident more choice, if anything else. And choice is what our residents and our families should always have. And no, a POA should not be choosing this, because a POA should only come into play when the person cannot speak for themselves or communicate in any way, shape, or form. So even, even when somebody with a guardian, if the person can speak, the resident gets to make their choice first. And sorry, that's like a soapbox for me.
Mm-hmm.
Is there any other questions we can answer for people?
I'm going to raise your hand or just speak up.
Speak up, please.
One question I had was that, in the discussion, I realized that this does not cover assisted living facilities, which is a state by state thing. I think that's important for people to know, because there are a lot of people who might think, oh, well, this would cover me, which is not the case. So it is complicated.
And the other thing it does cover that people don't realize either is it covers pediatric facilities.
Mm-hmm.
Because pretty much every pediatric facility in this country that I know of takes Medicaid. And because of that, this covers them. And people did not realize during the pandemic that there are about 500 of them in the United States. And if you think any of us had a hard time, and my son was an adult, um, talk to a parent who had a little kid in one. And I know one who literally was hundreds of days without seeing her son, or without touching her son.
There are
And
questions about residents with dementia or other types of cognitive impairment who may not be able to designate that person themselves. And so, as with all other decisions for that person, the person who is designated as their representative can make that determination as to who the essential caregiver would be. If a person doesn't have a family member or friend, if there's a clergy person that they're close to, or would like to see a clergy person, they can designate someone else. It doesn't have to be a family member or friend. The point is, it's that the resident's choice who they designate to be that person. So there are a lot of residents who don't have family members or friends that live close by, but may have developed a relationship with someone else who has come to visit them in some other capacity, and they can designate that person to be their essential caregiver if they so choose. And I just want to reassert that there is no specific service that has to be provided. We initially did not want that to be the case because a couple reasons. One is that an essential caregiver provides a lot of different kinds of support based
Hmm.
on what that individual needs. It may be emotional support. It may be communication assistance. It may be um, um, it may be physical, some sort of physical support. We also have to remember that despite these provisions, the nursing home is required to have enough staff on hand at all times to provide the care and services that each resident needs. So an essential caregiver is not meant to replace the staff that are required to be there. That's a different argument, but the essential caregiver is there to support the resident and to provide that type of emotional, physical, whatever type of encouragement and support that they generally provide to that individual so that they are not feeling isolated. But that doesn't take away the fact that the facility still has a responsibility to ensure that there are enough staff on hand to meet all of the residents' needs.
Let's see,
Just
maybe.
wanted to add one thing, Carrie. So as mentioned, so this is something that has both currency and urgency. It's current. It's not just about COVID. It's about going forward, and it's urgent because of the process in our in Congress. So what should people be thinking about in terms of what's our time parameters here in terms of pushing this through?
Well, as Carrie said, I mean, we want to, keep building momentum, and
Hmm.
ideally, it would get passed this year. Because if it doesn't get passed this year, as she correctly stated, we have to start all over again, and it's a
Hmm.
new Congress starting next year. There are big
Okay.
elections happening this year, and in terms of the midterms, and so next year, a whole new Congress is seated. So I think that, whatever push and pressure that we can put to encourage the legislature to take it up now, we want to do that. We don't want to be waiting and trying to go through
Hmm.
this again in the future if we don't have to.
So I think we're out of time.
Okay.
So somebody did ask, and I want to touch it real quick. Is there anything in here for provision as far as ombudsman go? No. Or at least not to my knowledge. This is an essential caregiver bill. And the same way
Right.
we were told the odds are of us not being able to omnibus into another bill, we needed to keep this bill very clean, very simple in hopes of getting it. And Susie, yes, there are provisions in here for homes that don't comply.
Just one more question. Do you see,
Go
will
ahead.
starting over require another rewrite, or is this one good to go again?
No, every new Congress requires a rewrite.
I mean, ideally, ideally we would be able to continue to move forward, with this bill as it's been. I mean, this bill looks different than the first time the bill was introduced a couple of years ago. But it's been refined each step of the way. We've got more and more people who have signed on as supporters. A number of national organizations have signed on to support. There are a number of members of Congress that are already signed on as supporters. So that momentum's been building. So if for some reason it doesn't pass this year, this is the version we would start with again, and hopefully not have to change it. But I think the goal is to get it passed this year.
Mm. I see one last question about does this bill cover mental health long-term care facilities?
If it's a Medicaid or Medicare
Medicare.
facility,
Okay. So that's the requirement. Okay.
yes.
Well, I just want to thank everyone for participating. It was a really great discussion. I commend every. Do you want to, Emily? Should people put our guests and Carrie put once again their contact information in the chat in case people want to follow up with questions?
Sure, that would be
I was
great.
just going to say, Paula, I'm putting my email in the chat right now.
All right.
If you want to reach out to me, Paula, I'll help you with any questions you have or concerns. And if I can't, I'll connect you to Lori or somebody else that can.
Okay. Okay.
And I could add it to the follow-up email as well.
Okay. Great. Great. Okay. Well, we could certainly keep on going, but I really appreciate everyone's participation. It was a great discussion on a critical issue. So I want to thank everyone and remind that we will be sending out notices and we'll follow up on this recording for people to spread around. I think Carrie's comment about loneliness is important. I think that's what it's about, social isolation. So there are lots of groups now that are focused on loneliness and social isolation. And I think we need to connect with these groups because that's what the issue is. So again, on behalf of the Great Panthers, thanks very much. We'll be having another Transformation Tuesday coming up next month. Carrie, do you want to say anything about that?
I'm going to just apologize right now for not remembering.
Okay. But
Ron will tell you, I've been pretty sick the last 2 weeks, so just getting to today was a big step in the right direction. So
we appreciate all your efforts, Carrie. Thank you very much. But
yeah.
we'll have another session at the end of next month, and you'll can find out more about that later. So again, thanks everyone, and have a good afternoon.
Thank you.